Okay.
Okay. Can everyone hear me and see my screen?
All good, Chris.
Okay, brilliant. I'm really sorry, I can't put my camera on. I can't work out how to do it. I know, I just have. Brilliant. All right. I have got just a short presentation to share with everybody. We had quite a long discussion, obviously, with Hampshire Parent Carer Network and with Service Manager, just to decide what was most appropriate to share with you today and what would be most helpful. So I hope this brief update is going to be helpful. We've got a number of sessions going on which are being hosted by Hampshire Parent Carer Network over the next few weeks. Sarah's already mentioned the clinic sessions, which are much more focused on individual concerns that you might have and unpicking particular issues related to special educational needs. My colleague Karen Nye will be sharing the updated SEN support guidance, which I'll refer to in my presentation over the next few weeks. And there are some focus sessions on post-16 and transition that we're planning. So it felt most appropriate to share with you just a brief update on where we are with regard to some things that I hope you'll be interested in. So, technology is not working. That's helpful. So just to make you aware that the SEN service is working remotely and it's expected to continue to do so for the foreseeable future. So in line with every other particular organisation, except for those that are working face-to-face, then everybody is working remotely. So just an update, you might have noticed some particular changes around links, localities, people that are managed that you're working with. We've tried to make it as seamless as possible, and we believe that the new 4 locality areas that have been put in place are working well, and they continue to increase capacity within the teams. And so certainly from our point of view, that is working really well and has met the need that was instigated as part of the SEN service review and the update. Really good news. The vast majority of the backlog has been cleared. We've shared before, it wasn't good news that we had a backlog, but in the vast majority of circumstances that has now been cleared and we are moving towards business as usual. Really good news. We've got green shoots of progress, which won't have filtered through to parents yet. And we do understand that there's still significant concern about timeliness, but we made 81% of the first decisions whether to proceed to education, health and care needs assessment in December. And that's really good news for those education, health and care needs assessments and requests that are just coming and starting to come through the service. We've got very good support from our educational psychology service, and alongside decisions being made early, then we have the capacity within the educational psychology service, we believe, which will help to continue with the timeliness that we're working towards. So just a couple of updates. We've got a joint focus on improving the 20-week performance and completing the phase transfers. Sometimes in the past, it might have seemed that we are focusing on one thing or the other, that we've closed the service for a particular period of time, that we haven't taken calls and we haven't attended meetings. Whilst we are cutting down on the amount of time that we are out of the particular focus on these particular areas, we are still working on both of those joint things together, because we're aware of the real concern around timeliness, but we're also aware that parents want to know where their children and young people will be going for phase transfer at years 2, 6 and 11. So we are focusing on that. It's really important to say that we are aware that parents just want to know where their children and young people are going. Some parents are also concerned about the education, health and care plan. We are aiming to meet the deadline for as many children and young people as we possibly can. And where we aren't able to issue the education and health and care plan with the amendments, we will be seeking to agree placement with parents ahead of that, with the involvement of our schools and other professionals in that process. The SEN helpline we're continuing to work on. We understand that there's still parental feedback, and I know I got that very strongly, and Michelle Hannah-Lucas got that very strongly. We really appreciate feedback and will continue to act on feedback, but we believe that the system is improving. We are recruiting particularly for permanent staff, which we believe will help. And we've increased the number of staff on calls as part of the restructure. And that again was based on feedback, because parents didn't feel that they could get through appropriate to the helpline. And I'm sure I'll get some questions on that particular area, but that's from our point of view what we're aiming to do. So we've got 55% of the calls are dealt with directly by the helpline team, or they are passed on to the caseworker with a detailed message being taken. So an update on where we are. We have, as you're aware, we previously shared that we have a full-time equivalent now of 52 SEN caseworker capacity. We recruited 16 additional caseworkers in September 2020. So as you can imagine, any recruitment process, that is still a long process by which those caseworkers get to really fully understanding and operating really truly at the top performance within the service. And that doesn't happen within a term. We have got 7 caseworker positions still to recruit to, and we have advertised, and we're in the process of interviewing. We have put in place a package of intensive training and mentoring, and that's been taking place since November 2019. Those caseworkers that joined us early in the process, or who were already with us and transferred into new roles, have now got a really good skill set, and this has only been mildly impacted by COVID-19. So we're running a virtual training program, we're still doing the mentoring, and I think along with a lot of other organisations, the COVID-19 hasn't impacted on our training and an ability to actually induct staff into the service. Just a bit of an update around the Education, Health and Care Hub from my colleague Steve Devlin. Really for information only, it's a better IT platform. Other local authorities have fed back alongside Hampshire, and the organisation we're working with have tried to make it more user-friendly. We can edit within the hub, which reduces the amount of work required outside of the hub and the number of wraparounds. Whilst that may not seem important for parents, what it does is improve productivity for the SEN caseworkers. So the less time they have to work on workarounds, the more they're able to work on amends and getting things through the system and improving our 20-week timeline, which will hopefully eventually feed through to timelines. We are now able to use the annual review process for those that have plans that we've actually got fully on the hub. That whole process of annual reviews will be much smoother. I've certainly spent quite a lot of time this week unpicking concerns from parents, particular parents, around annual review processing. And with cross borders, it's quite difficult, different platforms, different security, and it does create quite difficult circumstances. So we are hoping that that will again feed through to parents. We will share with Hampshire Parent Carer Network the specific sessions and show how it works so that we can involve parents in that process. We don't think parents will see much change, and the reason that I'm feeding it back to you is particularly for those reasons that I've highlighted, that we hope it will improve productivity within the service. Really importantly, the SEN Supporting Schools. This came out through the banding consultation. It is something that's come out through SEN clinics. It's something that we've been aware of, that parents are concerned about. Feedback from Karen that she really appreciates all the input from the networks and from SENDIAS in the development of this updated document. This updated guidance is being shared with schools in the week beginning the 22nd of February and will be on the local offer for parents to have a look at the same week. We will be providing a copy today to Hampshire Parent Carer Network so that they can see that in advance. Higher staff are planning a range of activities and events with school staff, governors, etc. in the coming months to share the guidance. Just to give a bit of an overview for those of you who haven't heard it before, this is very much building on the principles of the Code of Practice, focusing on partnership with parents, and it has been developed definitely through feedback from parents about what parents want schools to do and the engagement that they want with their schools. And it is designed to improve SEN support, exactly as it says, SEN Supporting Schools. So the aim is to use the guidance to underpin wider work regarding inclusive schools and meeting those with special educational needs and disabilities before the need for an education, health and care needs assessment. Our message very, very, very loudly is that we've heard the concerns of parents that have emerged, as I've already referred to. And whilst we're aware of some excellent provision for special education needs and disabilities in schools, we also are aware of consistencies, and this work will absolutely inform our work moving forward. Something else that I know concerns parents, we now have a SEND Place Strategy Board. This is a development, and Hampshire Parent Carer Network will be included in that. So this is our move towards co-production with parents, particularly in all areas of special educational needs and disability and around the development of specialist placements. Autism Academy is for children with social communication needs, is opening in April 2021. And we have got funding confirmed for a new social emotional mental health special school in the northeast of the county. And we are doing further work on the development of resource provisions. The updated SEN strategy will be published next week. It's got the 7 key principles highlighted. These hopefully will be familiar to everyone, but I think it's worth highlighting them yet again, that this is our vision and this is what we are working towards. Look out for that. It will be on the local offer. And then, yeah, SEN helpline. And I think that's it. Thank you, Sarah.
Super, thanks. Do you want to stop sharing for me?
I will, if I can work out how to do that.
Should just have a little stop sharing button. Otherwise, I can probably do it. Hang on, let's see if I can do it.
Stop.
I can do it. There you go.
Thank you.
There we go. Right. Okay. So a couple of questions. If anyone else has one, please do whiz them onto chat for me. So the first one is about evidence for EHCPs and what evidence is allowable. Through the Code of Practice, I believe the wording is that all evidence submitted has to be considered. And this question says that we're hearing reports from the SEN team are saying private assessments cannot be used as suitable evidence of SEN, or indeed for any other particular area. So can you just clarify the position on providing a private assessment as part of the EHC process, and that, because there seems to be some discrepancy between the Code of Practice and perhaps what caseworkers are saying to people?
Yeah, I think I previously clarified this, Sarah, at a number of meetings, and continue to give the same message to other parents who haven't heard my response to it. the Code of Practice is very clear on private reports. They have to be considered alongside any other report that is provided as part of the Education, Health and Care Needs Assessment. The information contained in them and the recommendations will be taken into consideration when the Education, Health and Care Plan is formulated. And alongside any other professional evidence, it's the collation of that evidence and looking at need and what is required to meet those needs that is then put into the Education, Health and Care Plan. So there is absolutely, any message that's gone out that those aren't considered or aren't appropriate to be considered is just not the case, and it will be against the Code of Practice. So they are considered. And if that doesn't mean, Sarah, that we take all the recommendations, though.
No, because it's considered. It must be considered, and obviously,
absolutely.
Absolutely. If a parent feels that they're being, it's being implied that their evidence won't be taken into consideration, what should they do? Because certainly it seems to be indicated that people are being told that private reports won't count. And I think particularly where we've got delays in particular, I know autism in particular, where we've got delays in those systems, people are going out, and dyslexia as well, actually, people are going out and getting private assessments. Those will be taken into account, won't they?
They absolutely will. What we can't do, though, and I just need to give the message, is take those private reports over Hampshire County Council commissioned reports. There's a bit that we've previously shared within the Code of Practice, particularly around educational psychology, that whilst we can take information and consider information from private psychology reports, that we have to commission our own report. And that particular wording has been previously shared with Hampshire Parent Carer Networks. I'm sure that's available, Sarah, somewhere. I think the answer to the question is we need specifics. If you're being told as a parent that your evidence won't be considered, you need to raise it through Hampshire Parent Carer Network, and it will be passed on to me or one of my colleagues, and we'll have a look at it, specifics of that.
I certainly know in my own experience that we had a private speech and language therapy report actually, and an NHS report that didn't actually agree. And I suppose the challenge is, which one therefore is taken into account?
It depends. I mean, it's all individual circumstances, Sarah. I think that's the difficulty. There's no one answer that I can give because it's so individually related, and it depends which bit there's a disagreement over. Is it a disagreement over provision, or is it needs, or is it recommendation? So I think it's really difficult for me to give a generic answer to that, and I wouldn't want to.
No, I understand that. And interestingly, it's just creating a few comments with people saying they've commissioned reports because Hampshire haven't necessarily done them. And I think it's for a lot of parents, it's a way of making sure they get through the process. Yeah.
I mean, sorry, Sarah, it might be helpful to bring Matt or Catherine in with regards to the therapy reports. Just to provide that information, and just a reminder about thresholds and processes, because the comment that sometimes is that it's Hampshire as part of the education needs process. Hampshire County Council has to request reports. The reports are multi-agency and are health, social care, and special education needs education. So some of it also gets lost in translation because there's such a lot of terminology.
Comments, and I know this is a hot topic. Two people talking about OT assessments, and the fact that that's can be a particularly, or seems to be, PD, and there's no the fact that there doesn't seem to be sensory support, and so people are sort of going and looking for support for that, and not necessarily feeling they're getting what they need. So if we could just touch on OT, because I know that OT and sensory in particular is a really hot topic.
I'm happy to talk about that. So
thanks, Catherine.
When we talk about private assessments and private treatment, every family has every right to pursue that. Of course you do, that's up to you. What I think is really, really important to always make really clear to families that if recommendations from a private assessment come out and they are not recognised by NHS commissioned pathways, then it won't be available. It may not be available on the NHS. Not always, but it may not be available on the NHS. So under NICE guidance, under the NHS guidance, there are all sorts of conditions and treatments and services that are available, but they don't always match up with what a private provider may recommend. And I think that's really important. I really do, because when you go to pay for an assessment, because of some of the really valid reasons that have already been mentioned about, you know, getting evidence for your EHCP or getting through an ASD diagnosis, of course they're really important, but what we want is for your child to continue to be supported after that time. So sensory is a really good example. What we're doing at the moment is we are looking at our therapeutic services that are available in Hampshire. We know that sensory support is really important, and in the service specification, some level of sensory support is available in the NHS. But I think it's that terminology and that language and expectations as about what should be available for your child's need and what is available on the NHS. That's something we're looking at. We want to make sure that sensory support is available. It may not end up being through OT. We may decide to commission something differently, but we have to go with what NHS services and NHS England recommends is available on the pathways. So sensory integration assessments, for example, aren't always commissioned by the NHS, and a lot of places they're not, but they are in private organisations. So a family may go for a sensory integration assessment, they may get some recommendations, but that doesn't mean it will then be available in NHS pathways. So, I mean, as CCGs and as providers, we're always happy to clarify that with families before you go for a private diagnosis. And I would absolutely check with whoever you're going to get those recommendations, to get that assessment completed. You talk to them about what recommendations may or may not come out that are available on the NHS. Because
can you clarify something for me there, Catherine? Because it's about need, not what's available. So if a child
it's absolutely about need, yeah, but if it's not recommended within the NHS guidelines,
but surely they won't recommend something that they haven't got to provide. So isn't this where there's a sticking point? So
there's NHS England with all sorts of things that are available, and CCGs can commission things in slightly different ways depending on the area.
Okay.
So we're always looking at the needs of our communities. We're always trying to commission what's best for our communities, but we've got to be fair and we've got to be equitable, and you've got to get the balance between making sure that we can provide as much as possible for the money that we have, because we don't have an awful lot of money, and that's not our choice. It's, you know, it's what's given.
No, and I think from what I've seen and from comments I'm seeing, one of the challenges comes that if a parent can demonstrate a need, that these things then sometimes get provided privately. And I know ACE, I'm aware of ACE myself locally, are then providing that service, and that's actually costing more than if it was actually provided perhaps more directly through the NHS. And so that seems to counter what you're saying. We're not using the most efficient way of providing the service.
So it's about the numbers coming through, and if there are processes in place, they're called individual funding requests, where if there is significant clinical needs, the CCG will pay for something outside of normal commission services. It's not guaranteed. It doesn't happen very often. But of course, we want to meet the needs of children, especially where there's some really complex and challenging issues. We really, really do. If there seems to be some themes and those requests get bigger and bigger and bigger, and suddenly we're doing exactly as you say, we're paying more for private than we are for standard, then of course we'd look into commissioning arrangements. We always do, and we're always reviewing our services, and that's exactly what we're doing with our therapy services at the moment, of which Hampshire Parent Care Network representatives are attending and will be included in every step of that procurement.
It's certainly one that comes up, sensory, in my get-togethers and my getting-togethers with parents more than almost anything else.
Yep.
And
okay, that comes across everywhere, and that is something we are looking at.
A couple of others, might be back to Chris. A question about the hub. Are parents able to access the appendices when they receive their draft? I've spoken to some parents that have been unable to do this.
All the information should be on the hub and accessible is the answer to the question, but I can't answer the specific question. I'm really sorry, I don't know it well enough, but I can take it away and I can get an answer back through you.
Just check. And secondly, if a parent does need help with the hub, is there still access to hub champions?
Yes, in each team. Yes, there is.
Okay.
Yeah, definitely. And that's one of the things that we've definitely developed.
I think sometimes it's frustrating for a parent when it's the technology that actually seems to hold us up rather than, anything else.
It shouldn't anymore. I mean, the upgrade to version 7 is supposed to iron out a lot of the difficulties. And so hopefully, fingers crossed, it should be a much better platform and much more accessible and easier to use.
Okay, I'm just going to read this one out. What happens when the LA name a school as the named school, but that school is unable to meet need? Somebody who's named an independent school as it feels the school is able to meet the child's needs, and the LA have consulted with the school, but I've been given 2 weeks to make a decision on the named school when I cannot visit. And without visiting, I can't make a decision. What should we do in this situation? It's strange times, isn't it? But what's the advice, Chris? Because people, these are big decisions for people.
They are, absolutely. I mean, it's difficult. Again, I'm really sorry. I keep going back to individual circumstances. What I would recommend is a conversation with the SEN caseworker or the special needs officer. In relation to visits, there should be a virtual offer. I know Karen, a couple of my colleagues in Harris have been working really closely, and the school improvement managers with schools to make sure that there's a virtual tour. I mean, head teachers are still available, as are SENCOs. That should not be preventing access to information about schools. I know it's different, and we have to look at things in a different way, but these decisions shouldn't be being held up because of a concern about not visiting, because school...
No, but I think so much of what we do as parents when we go to a school is about our gut feeling, about meeting somebody, and we're trusting them with our children. And I think I do think it's really hard at the moment, and also just visualizing the physical aspect of a school. It's just really, really tough. Not really a question here, but I just want to go back to read this out because we've talked about OT and so that Catherine's heard it. Somebody in Hampshire obviously saying, they've been told by their paediatrician that they suspect SPD. Referral is made to Hampshire NHS, but we're told it's not part of their service. Go private to get a diagnosis, but I'm told it wouldn't be considered as part of the EHCP. And yet, if we lived 5 minutes away in Surrey, lots of us living on borders here, you'd actually get it on the NHS. And just that frustration that paediatricians are diagnosing something and then the NHS currently unable to provide. So, we've talked about OT, but I think it's really something, sensory and OT is something that we need to look at.
I think it's really important to understand, and again, as Chris said, it's about the individual cases, isn't it? But is that paediatrician, and we see this a lot, is the paediatrician diagnosing, or is the paediatrician suggesting a condition? Okay. Those are two very different things.
I suppose it's a tricky one, isn't it, Catherine? If a paediatrician is suggesting to a parent that they investigate SPD, and then you have to go privately to get it diagnosed, it's a bit of a, parents are left in a bit of a black hole, aren't they?
Yeah, I don't disagree.
Okay, super. I might come back to a bit of sensory in a minute because it's all doing bits here, Catherine, but do you want to have a chat to us about your bits, and then we can always come back to that?
Yes, absolutely. So thank you. Now I tend to babble on when I get going because I'm very passionate about the two subjects I'm going to speak about. So I will, Sarah, please interrupt me, stop me talking, because I want to give families the opportunity to ask questions. If there are individual questions about individual situations, I'm more than happy for them to be forwarded to me through Hampshire Parent Carer Network, and we can have a conversation separately. So my name is Catherine. I am the Deputy Designated Clinical Officer for Special Educational Needs across Hampshire and Isle of Wight. I'm also responsible for autism services and as therapeutic intervention as well. On the call, we have got my boss today, who is the designated clinical officer for SEND and associate director within Hampshire and Isle of Wight CCGs, who is Matt Powell. Matt might step in case I get something wrong, or need to give me some more information regarding physical or mental conditions.
Welcome, Matt. Medical
conditions. So I want to talk to you about a couple of things. First of all, mental health. And I think Matt's put himself on the camera maybe to talk to you about mental health, because we know that at the moment it's a real struggle for families and children and young people, especially dealing with the impacts of COVID, and of course where the new homeschooling arrangements are being put in place and extended. And we know that generally that mental health services have got very long waiting times, much longer than we would want in Hampshire for children and young people. COVID has exacerbated that. We've had an increase in numbers, as you would, I'm sure, expect and understand, and that is causing concern for our services. But there is some good news. I wanted to tell you that we have, Hampshire and Isle of Wight have identified significant investment into CAMS for children, into mental health services for children and young people, and eating disorders for children and young people. It's been agreed, the services are aware. It's now down to the services to recruit, and we know that can take some time, but we will see a slow and steady change to children being seen, not just in response to COVID, but over future years as well. So we're really, really excited about that. We know it's a long time coming. We know that it doesn't help you here and now, but I wanted to give you that news. There are a couple of mental health services that are available for children and young people and parents as well, who may be struggling with some distress behaviours that your children are going through at the moment. I think Sarah's got the details. I've got them as well and can put them in the chat in a minute. There is the Hampshire and Isle of Wight crisis line, which is a line for children, young people, families and professionals to call to get some advice and guidance. There are trained therapists available that can speak to you, that can really help give you some advice about maybe what you can do to support your children going through a really tricky time. There's also a smartphone app for those of you who've got the technology called Think Ninja. It's free, it's downloadable from the App Store. Hampshire were actually one of the first commissioners to buy the app, and NHS England have now made it completely free for every child across the UK. So it's available to use, and what it does is it's something for children to go on. They can play particular games, they can link in with a little tiny chat bot that will talk to you about your feelings. It will look at some of the words that children are using, and it will point the child to different types of resources and help. It is something that the children that have used it, especially older children, have really benefited from. We're also looking at other ways of improving services, looking at online counselling services, but we do have young person counselling services available via No Limits. Again, Sarah, I've got the link if we need to put it on there. That's been a long-standing commission service that will look at all types of anxiety, any trauma, maybe if there's some bereavement going on, but a number of different reasons why a child may need counselling. So please have a look at No Limits, and you can self-refer into that service. In terms of autism, this is probably one of the hottest topics I know for many families. We know the waiting lists are completely unacceptable. We have also identified a lot of money, and I say that like that because it is a lot of money to get waiting times for autism assessments down. The services have got the money now and they are using it, and we are looking to purchase a new long-term service from the 1st of October this year. To do that, we need to go through a number of project procurement, very boring steps, but we need to talk about what that service is going to look like, and also what complementary services are going to look like as well. So Sarah mentioned sensory support. That's something we'll be looking at. Pre-diagnosis, post-diagnosis, and all different things along the way in terms of neurodevelopmental conditions and challenges that children are experiencing. We do have some Hampshire Parent Carer Network representative involvement in the groups, but I would welcome many more. And we've also got a survey that's gone out through Hampshire Parent Carer Network. Now, I know this is a really tough time for everybody, and I know the last thing you need at the moment is to fill in a survey because you've got so much going on, I'm sure. But because of legal constraints, we have to go out to purchase a new service, which means we have to run the project now. And in order to deliver a successful project and get services improved, we really do need that feedback from you. So if you do have time, please spend a little bit of time to complete the survey and send it back. And for those who would like a phone call with me directly, I'm more than happy to do that. Please go through Hampshire Parent Carer Network. I'm happy to have a conversation at your convenience. When you've got a bit of downtime, perhaps over the next few weeks or months, please make use of that offer, because I really want to know what's happening for you. I want to know the good bits, I want to know the bad bits, and everything in between. So please,
I've put the link on the chat. If people can pick that up and use it, that'd be great, and share it within your own networks. That would really help.
Thank you.
Because Catherine needs, as many people as possible to make it a legitimate survey.
We really want this to be something that is built with parents' views and young people's views in mind. We really do. We've had a long time of short-term contracts and short-term money, which is why the waiting lists have grown. And now we've got long-term money, and we can put in a long-term contract, which is a massive opportunity for us. One thing I wanted to touch on is the impacts of COVID. Like many NHS services, COVID has had an impact on the rate of assessments. We have had some sickness with our with the clinicians who are delivering assessments, because they're so busy. They are seeing people, and there are a lot. The infection rate is really high. We have had nearly the Scn, who is the organisation who are delivering assessments, have had nearly all of their staff vaccinated now, which is great. So we can start to begin face-to-face assessments, but we'll continue delivering online assessments where we can. It is really tricky with online assessments, because not only do families need to have the right software and hardware, which I know isn't always easy. Also, the clinicians need to have as much evidence as possible, and need to spend time with the child to really make sure that they are making the right decision in terms of a diagnosis. So that's why there has been a slight delay. But as I say, our team have been vaccinated, and they're going to be moving forward. We're also extending our venues. So for those of you who have been invited for an assessment or have had an assessment, you may have gone to Aldershot Centre for Health, which I gather is a nightmare to get to. We have now got a deal with Hampshire libraries. So across Hampshire, we'll be using a number of libraries to invite families for assessments. As you know, they're very welcoming. They are central in communities. They're close. They're much more accessible, and they are autism friendly. And they want to work with us to make themselves even more autism friendly. So we're really pleased about that, because we're hoping that will reduce travel for you and the anxieties and the frustrations around that. One thing I also wanted to talk to you really quickly is that I've spoken to a lot of parents over the last couple of years, and I've responded to complaints and queries and general conversations. And what's becoming really, really clear to me is that there isn't necessarily the understanding, and I don't know why there would be, but there isn't the understanding between how the NHS works, how systems can be navigated, what's the difference between the local authority therapy services and in the NHS therapy services, how borders work in terms of CCGs, what about patient choice, lots of different things. So I'd really like to maybe dedicate some time, whether it's in one of these sessions or a separate session, around that to help families feel more informed. You're more than welcome to contact us, and if you want to put in a complaint, of course you've got every right, but I'd like you to feel more informed and more empowered.
I think it's one of those things you've probably heard me talk about before, Catherine, where parents are often sort of completely in the dark and left to go out and find for themselves what's out there for them, and it's just really, really hard for parents. And I think they need to be signposted by professionals, whether it's medical professionals or education professionals. And often we're just told, have a look on wherever and you can see what's available. And people aren't always in a position to be able to do that. And I live on one of those borders, and it's really confusing sometimes as to what is available to who.
Yeah, and I'd love to make that a little bit clearer. And do you know what? A lot of our NHS professionals aren't aware as well. The NHS is fragmented. It is made up of a lot of individual organisations. I came into the NHS thinking that it was the NHS and it was one big boss, and it absolutely isn't like that. And I'd love to be able to help parents understand that a little bit more. So if that's something that people would be interested in, I'm more than happy to follow that up.
That might be one for the future.
Sure.
Right, I've got a couple of questions based on what you've said. You mentioned eating disorders. Do the referrals have to come from CAMS, or can it be a self-referral from a parent or from an education setting? How do you?
So CAMS are the organisation that delivers the eating disorder service. So if you're in CAMS, you're in CAMS. So it's a normal referral route. So you can self-refer, you can go via a GP, and a school can as well. But with eating disorders, that's something that is always obviously incredibly emotive and incredibly frightening. But there are particular thresholds that meet an eating disorder and those that meet an eating difficulty. And for families, if a child isn't eating and they don't feel they're very healthy, that can be a really frightening time. So I would always advise going to your GP. Your GP can carry out weight checks and health checks to see if that child meets the threshold, because there are other alternatives as well. There could be meeting with a dietitian, etc. What I wouldn't want a family to do is refer into CAMS with a significant worry, and maybe the child doesn't meet the threshold, but then there's nowhere else to go. So I'd recommend going through a GP.
Okay, super. And back a bit to sensory. I mean, it really is a hot topic. If an OT assessment is done by Hampshire's preferred supplier, which I think is ACE, and it highlights that OT input is required, what funding is available to the education setting to make that happen? Who's responsible? Is it the CCG or the SEN team or the school? Who's responsible for the cost of that input if it's actually being recommended via the Hampshire's preferred supplier?
Chris, is this something that you want to come in? Because am I right in thinking it's a local authority, or have I got that wrong?
It depends on the circumstances, because any school can use their devolved budget to commission any report that they feel is appropriate when a child or young person is being supported because the school believes they've got special educational needs, or they do have special educational needs. So that's one route. If a child has an education, health and care plan, or and there's an annual review and that concern is raised, then there can be a discussion about whether it's via the education, health and care plan, through the high needs block, through the SEN service, or there is, as Catherine's already mentioned, the individual funding route that we sometimes have conversations with health around, but that's much less used than those other two routes that I've referred to, both of which are funded from schools block money for children, for meeting children's needs.
And, you know, I'd really recommend calling the NHS therapies service as well. They have a hotline, a helpline that's available, and they can provide ever so much information around what could be needed for your child. They've got a really great resource website as well. So I would recommend calling that line. I can share that with you, Sarah.
Yeah, when you get a second, can you pop it in chat to me or whatever, and we can.
There was one thing that I've completely forgotten to just let people know, which I think is really important, is that Autism Hampshire have just been commissioned as well by the CCG. So they are delivering parent workshops, and they're also going to be working with schools providing education around autism. So you can self-refer into Autism Hampshire, or you can be signposted in by following your autism assessment. You don't have to be diagnosed with autism to be able to access that support. So please get in touch with Autism Hampshire.
Super. Thank you. Okay, I haven't got any more questions just at the minute, but there may be some more that pop up. Andy, I know you're out there somewhere. Did you want to have a chat to us?
Yes. Hello.
Hi, Andy.
Hi, everybody. I'm here. I have nothing specific to say. I'm just here in case anybody had any particular questions or issues to raise.
Okay, well, if anything pops up that you're able to contribute to, then please do just, unmute yourself and pop yourself on. Just one really big generic question that I don't think we've answered, and apologies if we have, is what should schools be doing during lockdown 3 for pupils with SEN? I know it's a big one, sorry, it's a massive question, but does anybody want to give me a bit of a steer on that one?
Sorry, Sarah, can you repeat the question?
Yeah, it's not so much a question, but what should parents of children with SEN's expectations be from their schools during lockdown?
Oh, from their schools during lockdown. I've got a slide. Hang on, I don't know what happened.
I mean, my experience is that what I'm seeing with parents coming to get-togethers, a child with an EHCP is a vulnerable child and has a right to a place in school, and I'm seeing a real mix as whether or not those children are getting into school and being offered that place. So I think it's just good to understand what people are entitled to.
I've got a slide. Could Andy give his bit, Sarah? Then can we come back to that at the end, and I'll find the information, because I think it's really
okay. I'll do. I don't think that Andy's got something directly, but if you give, I will do a few. I've got some bits and pieces, notices if you like, parish notices. So I'll do my parish notices.
Give me a couple of minutes, and I'll find
that's absolutely fine. So a couple of bits and pieces that I just think it's useful to mention to everybody while we're on the call. We've got some post-16 workshops coming up that HPCN is hosting along with SENDIAS. I don't know if that's relevant to anybody on the call. They will cover supported internships, employability hubs, and the help that Hampshire SENDIAS can offer to young people. I'm going to put the links to those in the chat. They're coming up over the next, I think they're all next week actually. And obviously that's quite a big hot topic for people as our young people approach that age. We have got our get-togethers and our Future in Mind sessions going on, as they have been through lockdown, all virtual, which makes it easier for people. Well, I don't know if easy is the right thing. Different, isn't it? It's different. It gives you opportunities to join in a different way and at a different time, because we've got evening sessions as well. I'm going to pop a link in the chat that's got all our dates coming in for February. If you go in there, you'll find all the dates. And the other place to go for all our events is our What's On page on the HPCN website, which I shall pop on there. And if you want it all to land in your inbox, we do send a newsletter once a month. What I would say is our newsletters can be quite wordy, but they're really worth sort of having a good look through and seeing what's on there, because there really is some good sessions that come up. So I popped those there. Now, if you're not familiar with Zoom, you can actually save the chat. It's, I think, probably easier on a laptop if you're on a laptop, but there's 3 little dots on the chat and you can actually save all those links if you want them for future use. Okay, let's see. I've got just a few other bits and pieces popping out. Thanks, Liz. Liz from SENDIAS has just sent me a link to the actual guidance, which I will put on there for everybody. Okay, I'm just going to give Chris a minute to see if you can find that bit of data. Has anybody else got any questions that they want to pose at this time to Andy or Catherine or Chris?
I was just going to say something, if I may.
Yes,
if I could just chip in. Yeah, we've been advising quite a few parents at the moment about what they can expect from schools at the moment. Mm-hmm. So in a nutshell, if it's helpful, if your child doesn't have an EHC plan, but they are receiving SEN support, then the school should be expected to provide differentiated learning at the very least. If the child is struggling with remote learning, then they can ask for paper versions to be printed and some sort of arrangement where the work can be collected from school. If the child continues to struggle with remote learning, then they could be considered vulnerable and therefore could attend school. If the child has an EHC plan, then the school have to do their best endeavours to meet as much of the provision on the plan as possible. And also there is no ramifications for not sending your child into school either, so there's no fines or anything like that. So if a child is shielding or is worried about bringing the virus home because their parents are poorly or anything like that, they can't be punished for not attending either. So there's a few little highlights, but obviously there's a lot more in that link that I've sent you with the latest guidance on restricted attendance.
Yeah, and we're certainly seeing a mixed bag in our HPCN get-togethers, with some, some students, some vulnerable children back in full-time, some in part-time, and obviously some of that's parental choice, but it isn't always. And people perhaps being told that they're struggling to accommodate. I certainly know, I'm in the north of the county, I certainly know the schools that are near Frimley Park are virtually full. Because there's so many key worker children there. So I think there is a challenge with capacity, and not everybody's getting the same experience.
And there's some problems with special schools as well, in some instances with staffing. And that is the only reason that can be cited for not being able to take in the students, is if it's for staffing reasons. So yeah, there's separate guidance for special schools, but everybody should be providing provision wherever possible. But
just as you mentioned that, I've got a comment come in saying we're struggling to get any accessible work for my son. He's in an SEN school. He's blind with cerebral palsy and non-verbal. And I think the challenge with that situation is it's the parents and young people in most need that are potentially the ones that are missing out.
Yeah.
We're working with schools, Sarah. Sorry, is that Liz? Liz has said
Yes.
that's done the slides for me because they were, for some reason, sorry, they didn't show up on the presentation that I did. Liz has exactly summarised what should have been in the presentation around COVID, funny enough. We're working with schools where parents have concerns, particularly if there's an education, health and care plan, Sarah. So some of them have been escalated up and we've had individual conversations with schools. But Liz is absolutely correct that actually staffing issues, bubbles, COVID issues are impacting on some of our special schools, and that's a valid reason. But we will follow up individual circumstances if there are concerns.
So what's the advice, Chris, if we've got a school that isn't sending home differentiated work for a child who's got an EHCP?
We would always advise that the conversation is, first of all, and you've heard me say this many times, that it's always best to work with your child's school to have that conversation. But if there are particular concerns and you don't feel that you're being listened to, or there is a particular difficulty, I mean, so for instance, this week I've had conversations with specialist teacher advisors around providing access to additional support in the home. So things are being followed up if there are particular concerns about access to learning, because we're aware that the legislation is really clear that learning should be continuing, and we want to facilitate it in the best way we possibly can. So, speak to the school, but if there are particular concerns about differentiation, ways of working, then we can always follow those up if the parents haven't been successful in unblocking some of those issues with the school.
I mean, remote learning is hard for all youngsters, I think, but it can be especially hard for our youngsters with SEN.
Absolutely, Sarah. And there are some things that we literally can't do anything about. We will try our best to iron out issues that we possibly can. But, schools are open.
Yes, and the interesting thing is the feedback I'm seeing is that some young people are really benefiting from being in a smaller group. Yeah. And actually they're really benefiting from that, and that it's lowering anxiety levels, and some young people are actually potentially benefiting from being at home. So I mean, I think it's an interesting time, and I really hope that we can all learn lessons sort of from this, maybe we can learn lessons about how to make remote working for children who struggle sometimes to be in school. I think there's a huge benefits we can learn from this time. We've just got to get through it first. Absolutely. And that is the difficulty, isn't it? Okay, I'm just reading this out as a comment. You can't address it, but I've been told by my SENCO that my child's one-to-one is being used for key worker children. Interestingly, I know that happened with my daughter's one-to-one as well in the first lockdown. I hadn't asked her to go into school, but because they're school staff, they get rolled into that rota and can sometimes make it harder for our children to attend.
I think what schools are trying to do, Sarah, is operate in the best way they possibly can. It is,
that overused word at the moment, unprecedented times. But it's so important that, last link doesn't work. I'll have a look at that in just a minute, Mike. Sorry, which one is that? Is that Liz's link?
That might be me. That was there is a workshop that's being held over 4 dates, 2nd, 9th, 23rd Feb and the 2nd of March, helping your child with autism child with home learning and remote learning. That might be of interest to some people, but I'll try and get a link that works to you. I think it's because I've taking it out of my internal folder. That's why.
That should have been obvious. Yeah. Okay, there's lots and lots and lots of data in that chat, so if people want to save that, they're welcome to. Otherwise we'll try and get some of it sort of onto our web pages and whatever bits that are new. I hope it's been useful. It's always a busy time, these sessions. There's always a lot of questions. We can't necessarily get everything answered. I hope we've helped. We've got another one of these Meet the SENs next month, towards the end of the month. I can't remember the date exactly off the top of my head, but it's all there on our What's On page. A big thank you to our contributors. It's always good to have Chris and Catherine join us. Andy, thank you very much for joining us, even though you haven't felt needed. I hope you don't feel redundant.
No, that's fine, thank you. No, interesting.
I think it's always fantastic to have professionals with us to sort of, you know, hear what's happening out there, you know, at the coal face, because the experience from one side isn't always quite the experience from the other. Okay, super. Thank you very much for your time, everybody. And I hope that I will see you on another get-together experience soon. I've just, I can see that the autism survey is busy being shared around, Catherine, you'll be pleased to know. So that's all good. Catherine, can I just ask, how many people are you hoping to get a response from?
For the autism survey?
Yeah.
All of them.
Yes, I know that. But what do you consider a sort of a legitimate sample?
Do you know what? I actually asked Hampshire Parent Carer Network at this, because you know you do this kind of thing all the time, and I don't know, but what I can tell you is every single response will be considered and looked at and included. Well,
let's get it out there as much as we can, folks, because you know, obviously the more responses you get, the more voices,
absolutely,
the better. I shall ask Mike. Chris, can you share your presentation with us to share? Actually, it will be on the recording, Mike. So this is actually recorded and the presentation will be part of that. So it'll be part of the video. And then you get it with Chris talking over it as well. So it's even better than just having the presentation.
Definitely not. Before I send it over to you, I'll add in the slides around COVID-19.
Okay.
Based on Liz's slides from SENDS.
Super, excellent. Thank you very much. Okay, I'm going to stop my recording and I shall close the meeting. Thank you very much, everybody.
Thanks, Sarah.
Thank you. Bye.
Thank you. Bye.